Not a lot of people turned up for the last day of public hearings in Pretoria, but the submissions were still robust. First up was the Cancer Association of South Africa. It complained about poor treatment of cancer patients by medical aid schemes.
There are so many fine print things that eventually materialize when the patient least expects it. For instance, they believe that their coverage for their condition is unlimited because it wasn't made clear to them that there are limits involved. And all of a sudden they run out of costs, and halfway through their treatment the funds run out and they don't get cover anymore.
Private heart surgeons also made an appearance. They also complained about mistreatment at the hands of medical aid schemes. They were followed by private nurses who also complained about the same thing.
There are many of the services that we offer that are not covered by medical aids, even if they are part of prescribed minimum benefits, very often because that's given out of hospital, not in hospital, and because many of the procedures that we're now doing, such as a lot of the family planning, don't have codes against which the patients can claim from their medical aids.
Cosatu was last to take the stand. The Labour Federation added its voice in condemning astronomical prices charged by private hospitals. It argued that the main cause of this is that the private healthcare industry is monopolized by a few conglomerates, and that needs to change.
The immediate thing in terms of this inquiry is that it must come with firm recommendations that will break up the private health monopolies in order to allow a process where an NHI, when it's introduced, can be successfully done so, rather than a situation currently where there are monopolies that dictate the pricing of medicine or of care.
People in charge of private hospitals and medical aid schemes will get a chance to tell their side of the story during the second round of public hearings in Pretoria next week. Bongeni Mutua, SABC News, Pretoria.